We had a 78-year-old who was using a cane. She also was having a lot of hip pain, low back pain, difficulty bending, difficulty turning over. And so we had done some traditional chiropractic care with her, but it just wasn't enough. And so one of the things that affect a lot of people that we just don't realize is a pubic symphysis subluxation. And so a pubic symphysis subluxation is actually a subluxation with the pelvis. The pubic symphysis is exactly what it says. It's a symphysis joint, so it's not movable like our hip, like our shoulder. Those are synovial joints. The pubic symphysis joint is a very strong joint, but it can subluxate, and when that does, it destabilizes the low back. It can give you hip pain, and it can cause a leg link inefficiency or deficiency. So one of the ways that we actually check for this is we'll bend the knees. And if you have a patient that when their knees are bent like this and you see one leg longer than the other, that is a very specific sign for a pubic symphysis subluxation. And so we treat this in our office on a daily basis. Patients, they begin to have difficulty rolling over in bed. They have problems on the opposite side hip, and then they also have debilitating low back pain. So when that symphysis joint goes out of alignment, it can really affect not only the low back, so this is our pubic symphysis joint right here, right in the center here, and when that goes out of alignment, it not only affects the low back, it destabilizes the low back, but also because the acetabulum and the head of the femur articulate with the ilium, that also can become affected. So if you're one of these patients that suffers from low back pain, but also hip pain, come and check us out. We're gonna help you, okay? We know what to do, and if we are really, really good at diagnosing and getting curious, we're gonna know exactly what we need to do to get you better.